Hello, everyone, and welcome to part 5 of our Psychology and Happiness course. So today we're going to be talking about stress management. So we're going to be talking about what stress is, what the stress response is, and then we're going to jump into some scientific backed ways to deal with stress more effectively. So this is a great opportunity to learn about different ways that can help you more effectively manage your stress in your day-to-day life. So let's jump into it. So, what is stress and the stress response? So, stress refers to a psychological perception of a threat and our body's response to it. So, the stress response actually starts in the brain. So, when we confront a danger, our eyes and ears send information to our amygdala. When the amygdala interprets the information as dangerous, it sends distress signals to our hypothalamus. Okay, and the hypothalamus then communicates to the rest of the body through the autonomic nervous system to prepare for danger. Okay, so now let's talk about the autonomic nervous system since it plays this huge role in stress and the stress response. So the autonomic nervous system is part of our nervous system that controls the automatic functions of our body, such as breathing, our heartbeat, our digestive processes, things like that. And the autonomic nervous system can be subdivided into two systems. So the first is the sympathetic nervous system, also known as the fight or flight response. And this prepares our bodies for action. Okay. The second system is the parasympathetic nervous system, also known as the rest and digest response. So this relaxes our bodies and slows down high energy functions. All right. So when our brains detect a threat, the sympathetic nervous system, or that fight or flight response, is automatically activated, which signals to our adrenal glands to release adrenaline and cortisol. And these hormones cause the heart to beat faster, respiration rate to increase, blood vessels in the arms and legs to dilate, digestive processes to change, and glucose levels in the bloodstream to increase to help us deal with the perceived emergency. Okay, and when our brains no longer detect a threat, our parasympathetic nervous system, or that rest and digest response, is automatically activated, and our bodies are able to relax and recover from the heightened physical and metabolic activity activated by the sympathetic nervous system, or that fight or flight response. So here's a great visual on the left that shows the different impacts that the parasympathetic and the sympathetic nervous systems have on different parts of our bodies. So as you can see from this visual, the sympathetic nervous system really prepares our body to fight or flee from danger, while the parasympathetic nervous system really allows our bodies to rest and relax. Okay. So what happens when stress becomes chronic or constant? Well, when the sympathetic nervous system is constantly being triggered, it's not really good for our health because it can drain our bodies and put us at an increased risk of many health problems, including anxiety, depression, digestive problems, headaches, muscle tension and pain, heart disease, heart attack, high blood pressure, and stroke, sleep problems, weight gain, and memory and concentration impairments. Okay, so stress at chronic levels is actually really bad for our health. So, should we avoid stress? What do you think? So, the answer is no. Avoiding stress completely is not possible. Also, a little bit of stress can motivate us and prepare us to meet our challenges. So, rather than trying to avoid it, we should manage it in a way that promotes our physical and psychological health rather than damages it. Okay. So now let's talk about a few ways that we can deal with stress more effectively. So the first way, and this is one of my favorites, is perceiving stress and the stressor differently. So remember, stress is a response to a perceived threatening situation. And studies have found that the way we perceive stress can impact how our bodies respond to it. Okay, so according to Stanford psychologist and research expert Dr. Kelly McGonigal, researchers found in a study that those who had high levels of stress and believed stress was harmful to their health had a 43% increased risk of dying, which is significant. However, those who had high levels of stress but did not believe stress was harmful had the lowest risk of dying in the study, even compared to those who had low levels of stress. Okay, and according to Dr. McGonigal, a study at Harvard University found that those who viewed the stress response as helpful to their performance experienced more courage, less anxiety, and their physical response to stress changed. So I hope you're paying attention because this is really important. Rather than their blood vessels constricting as they typically do during the stress response, which can be damaging to our cardiovascular health, their blood vessels stayed relaxed, which is a much healthier cardiovascular profile. So, how can we perceive stress and the stressor more positively? So, one way we can do this, according to one expert, is reframing statements around stress, like, I hate this feeling, it is harming me and my health, to this feeling is helping me rise to this challenge. Also, reframe statements around the stressor that identifies the opportunity in the stressful situation. For instance, change, I hate this experience, it is stressing me out, to this is an opportunity to learn, or this is an opportunity for me to become stronger and better, or this is an opportunity for me to prove my courage. Okay, the important thing that I just hope you remember is that our inner self talk regarding the stressful situation is really important because it has a big impact on our body's response to it, response to stress. Okay, let's move on to number two, or the second way to deal with stress more effectively. So this is seeking out social support. So according to Dr. McGonigal, when our sympathetic nervous system is activated, that fight or flight response, our body releases oxytocin, which is a hormone that makes us crave social connections. So our stress response is actually trying to drive us to seek social support. After we seek social support, more oxytocin is released, which stimulates comforting feelings of connection. But it doesn't stop there. Okay. Additionally, oxytocin protects our bodies from the stress response. It is an anti-inflammatory. It helps your blood vessels stay relaxed during stress, like we talked about, is a much healthier cardiovascular profile. And it helps heart cells heal from any stress-induced damage, which is incredible. So, our stress response is trying to drive us to seek social support to help protect our bodies from any damage caused by the stress response. So, when we reach out to others when we are experiencing stress, our bodies are protected and they recover faster from any damage caused by the stress response. Okay, so this is an extremely effective way to deal with stress more effectively because not only can it help alleviate some of that, those uncomfortable feelings associated with stress, it also protects our bodies from the stress response. Okay, all right, now let's go on to number three, the third way to deal with stress more effectively. So this is helping others. So according to Dr. McGonigal, researchers in a study found that for every major stressful life event, like financial difficulties, a family crisis, things like that, many participants' risks of dying went up by 30%. However, for those who reported that they spent their time helping others, they showed no stress-related increased risk of dying. So, although stress sometimes can make us want to turn inwards and kind of just focus on ourselves, research has shown that it is much healthier and more effective to turn outwards and be focused on others and others' needs. So, a question I'd like you to ponder for a moment is, why do you think that is? Why do you think that helping others seems to be this protective factor, this thing that protects our bodies and our health from the stress response? Why do you think that is? So, one reason why I think this could be is because helping others often puts our own problems into perspective, which can help alleviate some stress associated with our problems. But also, according to the Cleveland Clinic, helping others secretes serotonin, which improves our mood, dopamine, which creates a sense of pleasure and reward, oxytocin, which creates a sense of connection with others, and like we've talked about, can protect our bodies from the stress response. And it decreases cortisol, the stress hormone that makes us feel overwhelmed and anxious and can damage our health when it's in high and chronic doses. Okay, so this is another great way to help us effectively manage our stress in a healthier way. Okay, now let's talk about number four. The fourth way to deal with stress more effectively is spending time in nature. So studies show that spending time in nature effectively reduces stress. Additionally, spending time in nature increases cognitive performance. Specifically, studies have found that being exposed to natural environments improves working memory, cognitive flexibility, and attentional control, while exposure to urban environments is linked to attention deficits. So, one theory as to why this is because spending time in nature has been found to replenish our cognitive resources, restoring our ability to concentrate and pay attention. Okay, also, research has found that spending time in nature is associated with increases in happiness, subjective well being, positive effect, positive social interactions, and a sense of meaning and purpose in life, as well as decreases in mental distress. Additionally, spending time in nature may also decrease our risk of developing many psychiatric disorders. For example, one study, and this study is huge, it studied, I think, around 900,000 people. And this study found that children who lived in neighborhoods with more green space had a reduced risk of many psychiatric disorders later in life, including depression, mood disorders, schizophrenia, eating disorders, and substance use disorders. For those with the lowest levels of green space exposure during childhood, the risk of developing mental illness was 55% higher than for those who grew up with abundant green space, which is significant. So, all of these wonderful benefits of spending time in nature combined can help us manage our stress more effectively overall, right? Because it increases cognitive performance, it makes us happier, makes us feel good, it decreases our risk of developing psychiatric disorders later in life. So, all these things combined can help us manage stress more effectively. Okay, the fifth way to deal with stress more effectively is through seeking professional help. So, professional psychotherapists can provide us with specific stress management tools that can be effective for our specific circumstances and challenges. Also, receiving cognitive behavioral therapy, also known as CBT, from a licensed mental health professional can help us learn to change unproductive thought patterns that have a negative influence on our stress to more productive ones that help us more effectively manage our stress. Okay, so this is also a great resource to use if you feel that it's difficult to manage the amount of stress in your life. Okay, the sixth way to deal with stress more effectively is through physical exercise. And we touched on physical exercise a little bit in the last class. So this is just a little bit more of a review. So as discussed in our previous class, physical exercise can improve brain function, which can help us perceive and respond better to stress as it arises. So if you remember from last class, exercise actually increases the size of our prefrontal cortex, that part of our brain. And as we increase increase the size of the portion of the brain, we actually increase that area's activity. And the prefrontal cortex is associated with rational thinking and decision making. So as we exercise and as we increase the activation of the prefrontal cortex, our ability to think rationally is enhanced. So when we are exposed to stress, or when stress comes up in our lives, we're better positioned to deal with it more effectively because our ability to think rationally is more enhanced. Also, studies show that exercise reduces cortisol, which, like we've talked about, can make us feel anxious, overwhelmed, and in high chronic doses can damage our mental and physical health. Also, exercise can improve our mood by releasing endorphins like dopamine and serotonin. So, exercise can also help alleviate some of those uncomfortable feelings associated with stress by helping us feel better. Okay, the seventh way to deal with stress more effectively is embracing uncertainty. So, studies show that feelings of uncertainty and ambiguity can increase stress. Tolerating uncertainty means not always having rigid expectations of the future. And according to Dr. Alyssa Appel, a psychologist and renowned stress researcher, strong expectations can hurt us, whether they're positive or something we're looking forward to, or negative, so something we're dreading. And while we may think that anticipating disaster helps us better prepare for it, Dr. Appel describes that anticipating the worst leads to spikes of cortisol that are harmful for our health and result in no better response to stress than not anticipating it. So really, I hope you remember, we're all at risk of ruminating. I know I've done it many, many times, but just remember that ruminating about a potential catastrophic event in the future, it unnecessarily increases cortisol, which can be damaging to our mental and physical health. In addition, also described it by Dr. Appel, it doesn't result in a better response to a stressful event than not ruminating on it. So try to remember that when you catch yourself ruminating about a potential catastrophe in your future. And Dr. Appel says that we can learn to tolerate uncertainty through mindfulness meditation practice, which helps us stay focused on the present and prevents us from ruminating about the future. Additionally, mindfulness meditation practice can relieve stress by deactivating the sympathetic nervous system, or that fight or flight response, and activating our parasympathetic nervous system, or that rest and digest response. Okay, so now we're going to finally jump into mindfulness meditation. And we've brought up this practice several times throughout this course. So we're finally going to dive into it a little bit more. We're going to talk about more of its benefits, and then we're going to finish with specifically how to do this practice. So by the end of the class, you should have all the tools you need to start picking up this practice. Okay, so what is mindfulness meditation? So a simple way to think of meditation is a practice that trains your attention to achieve a mental state of calm concentration and positive emotions. And mindfulness is one of the most popular meditation techniques and has two main parts. So the first is attention. So this is turning into your experiences to focus on what's happening in the present moment. This involves directing your attention to your breath, thoughts, and physical sensations in your body and the feelings you are experiencing. Okay, the second part is acceptance. So this involves observing those feelings and sensations without judgment. So instead of responding or reacting to those thoughts and feelings, you aim to note them and then let them go. And researchers believe that the benefits of mindfulness are related to its ability to dial down the body's response to stress, right? So this really is a great practice to help us manage our stress. So let's talk about a few benefits of mindfulness meditation. So meditation effectively reduces cortisol. And according to the Mayo Clinic, research shows that it can help people manage symptoms of conditions such as anxiety, depression, digestive problems like irritable bowel syndrome, asthma, cancer, chronic pain, heart disease, high blood pressure, sleep problems, and headaches. Okay, also, it has some wonderful benefits to our brains. So, research has found that practicing meditation decreases the size of the amygdala. And the amygdala, that part of the brain, regulates the fear response. And like we talked about, as you decrease a certain part of the brain, you decrease its activation. So as you decrease the size of the amygdala, you're going to decrease the amygdala's activation. It also increases the size of the prefrontal cortex, which regulates things like concentration and rational thinking. It also increases the size of the hippocampus, which is responsible for learning and memory. Also, it increases the size of the temporoparietal junctions, and these areas are associated with compassion and empathy. Okay, so as we meditate, our ability to think rationally, our learning, our memory, our ability to have compassion for ourselves and for others is enhanced. Okay, so this is some wonderful benefits of practicing meditation. Okay, now let's talk about some benefits of meditation on our minds. So, according to the American Psychological Association, researchers have found that participants who meditated were less likely to react with negative thoughts or unhelpful emotional reactions in times of stress. Also, they were better able to focus on the present and less likely to worry and to think about a negative thought or experience over and over. And according to Dr. Gladding, meditation can help you see yourself and everyone around you from a clearer perspective, while simultaneously being more present, compassionate, and empathetic with people no matter the situation. With time and practice, people do truly become calmer, have a greater capacity for empathy, and find they tend to respond in a more balanced way to things, people, or events in their lives. Okay, so a lot of wonderful benefits to mindfulness meditation practice. So now let's talk about how to do this practice. So first, sit upright in a comfortable position, close your eyes, and let your hands relax in a comfortable position. Then begin to pay purposeful attention to your breath and breathe naturally. So don't over exaggerate your breath, okay? Just breathe in a way that feels comfortable to you. Okay, then allow your thoughts and feelings to come and go. and remain non-judgmental of your thoughts and feelings. Okay, so just remain an observer of your thoughts and feelings while you're meditating. Then when you notice your attention is off your breath, gently bring your awareness back to it. And awareness is not the same thing as thinking. So you're not thinking about your breath. Okay, you are simply being aware of it. So you're feeling it, you're recognizing it. And remember, there is no bad meditation. The only bad meditation is no meditation. So remain non-judgmental of your experience with meditation each time you practice it. And when time is up, gently bring yourself back into the room. Okay? So those are kind of the steps to practice this mindfulness meditation practice. So it's going to feel really awkward and uncomfortable at the beginning because this is just a practice we're not used to. So just know that at the beginning, it's going to feel a little weird and a little awkward, and that's okay. And that's to be expected. So to kind of help you out with getting started, there are a couple of really good meditation resources that are offered online for free that I'd like you to go check out. So the first one is a 10-minute guided meditation with Calm. And I highly recommend starting with a 10-minute meditation just because, like I said, it's going to feel kind of awkward when you first start doing this practice. So I recommend getting comfortable with the 10-minute guided meditation before you move on to the 20-minute one. So the second one is this free 20-minute guided meditation with Dr. Jon Kabat-Zinn. And Dr. Jon Kabat-Zinn is a professor of medicine at the University of Massachusetts Medical School, where he founded its world-renowned mindfulness-based stress reduction clinic, also known as the MBSR clinic, in 1979, and the Center for Mindfulness in Medicine, Healthcare, and Society in 1995. So he really is one of these leading experts in mindfulness meditation. So his guided meditation is wonderful and one that's very, very helpful to help you learn how to do this practice. So the point of these guided meditations is just to help get you into understanding how to do this practice. Eventually, the goal is to have you do mindfulness meditation practice on your own, so that you don't need these guided meditations as much. But these are some great resources that we have available to you. So go ahead and click on them, go check them out, and they're great ways to help you get started in this practice. Okay, let's talk about some frequently asked questions regarding mindfulness meditation. So, is meditation recommended by medical experts? Yes. According to the Mayo Clinic healthcare providers practice evidence-based care. Healthcare providers recommend meditation and other complementary and integrative therapies that have been studied and tested for their effectiveness and safety. Okay. How often should I meditate? Well, it's recommended that you meditate daily. And how long should I meditate? So research has found that it's most beneficial if you can meditate 10 to 20 minutes per day. Where should I meditate? So try meditating in a comfortable, quiet space where you will not be disturbed. And how long does it take until I feel its benefits? Well, it's difficult to say, but research suggests about 8 weeks. Under fMRI machines, they found in research that participants, they start to have those changes in their brain that we kind of talked about earlier. Those changes start to happen at about 8 weeks. So these benefits don't happen overnight. So try to be patient with the process. And what if meditation feels too overwhelming for me right now? So often, meditation can feel overwhelming for many of us who have recently experienced a traumatic experience or who just live with a lot of chronic stress. So, in these situations, we should try breath work instead and start with breath work. And for more information on breath work, there's this great TED Talk by Max Strom titled Breathe to Heal. And in his TED Talk, he talks about breath work and some ways on how to do that. So we also have that link available for you to click on. So just follow that link and go learn more about breath work if that's somewhere you'd want to start before starting mindfulness meditation, or if it's just something you're interested in learning more about. Breath work really is a great way to start getting into mindfulness meditation practice, because what it does is it's really good at pulling us out of that sympathetic nervous system, right? That fight or flight response, and pulling us into the parasympathetic nervous system, that rest and digest. So breath work is a really great practice to learn. So go ahead and click on the link if you want to start there or learn more about breath work. Okay, now that we've talked a lot about what meditation is, let's talk about what it's not. So it is not a cure-all. According to Mayo Clinic, meditation is a type of complementary medicine. that is meant to be used in combination with other evidence-based interventions. Okay, so mindfulness meditation is going to be most effective for you when you're combining it with other things that have been studied and proven to be effective. Also, it is not an attempt to stop thoughts or empty the mind. Okay, this is not possible. Rather, you let your thoughts come and go and gently bring your awareness back to your breath when your attention leaves your breath. Okay. So in summary, the stress response starts in the brain and signals to the rest of our body to prepare for action through the autonomic nervous system. Chronic and high levels of stress can damage our physical and mental health if not managed. Ways to deal with stress effectively include perceiving stress and the stressor differently, right? Because that impacts the way our body responds to stress. Seeking out social support, which releases oxytocin, which can protect our heart and our bodies from the stress response. Helping others, which has also been found to be a protective factor. Spending time in nature, which has an abundance of benefits. Seeking professional help, embracing uncertainty, physical exercise, and through mindfulness meditation. And meditation can improve our mental and physical health, change the structure of our brain, help us manage negative thoughts and emotions more effectively. And practicing mindfulness meditation involves sitting upright in a comfortable position, closing your eyes, paying attention to your breath, remaining non-judgmental, bringing your attention back to your breath when it leaves your breath. Meditation also is recognized by medical experts as an evidence-based complementary intervention. Okay, so it has really been studied and proven effective at giving us a range of benefits for our mental and physical health. And for the best results, it is recommended to meditate 20 minutes per day, every day. And like I've said in previous classes, and I'm going to say also today, these are just general science-backed ways that can really improve how we manage stress in a more effective way. However, if you find that you are doing these things, you're practicing these things, you're giving them the time they need to feel their benefits, and you're still having a hard time managing your stress, or you're just going through something quite difficult to the point where it's really difficult to do these practices because your stress is so overwhelming, I highly recommend reaching out to a therapist, because a therapist really can provide you, like we've talked about, with that individualized care, resources, education, and treatment plan that can work for your specific circumstances and challenges. So if you'd like to be connected with one of our therapists, just reach out to this number found at the bottom of the screen, and they can help connect you to one of our amazing therapists at Connections Family Wellness. All right, and our last class next week is going to be wonderful. There's a reason I waited till the end of the course to do this one. It is my favorite. It's going to be about trauma and building resiliency in ourselves and in our children. And then we're going to talk about something called post-traumatic growth, or how we can experience growth after a traumatic experience. So I really hope that you'll join me for that class. It's a really great class that's going to give you valuable information and tools to help you deal with very difficult and traumatic experiences that we may all go through our lives. So hope to see you then. Otherwise, thank you so much for joining me today, and I hope you have a great rest of your day.